So we're gonna start with the level 1 glute exercises, and the gluteus muscle, so glute med, glute max, these big muscles here and smaller muscle here are hugely implicated in hip stability along with the core. And so if you don't have activation of the glutes because the hip flexors or the hips are tight, then that's going to create hip bursitis, IT band friction syndrome issues. Move down to the knee, you're going to get some knee problems and low back problems. And so if the glutes aren't firing as well, the hamstring, so this muscle here or this muscle in the back may be overactive, and that's going to pull your hip out, which creates one leg longer than the other. So it's really important to strengthen the glutes. So we're going to start with level 1. So level 1, you're going to get a band and you're going to attach it around your knees. You're going to lean back on an elevated surface. And all you're going to do is you're going to take your knees out and then back in. So you're going to do 10 of those. Then after you've done 10 of those, you're going to sit upright and we're going to hit another area of the glutes, keeping your foot on the floor. So we're not going to like move the feet. The feet are going to stay on the floor. You're going to hit another area of the glutes. And then you're going to lean forwards and you're going to do 10 more. So you can do 3 sets of 10 of these. Then you can get like towels and a slippery floor, or if you have sliders, you can get the sliders. You're going to put them under your feet. You're going to sit upright, and then what you're going to do is you're going to rotate your feet out and push against the band. And this is going to get another area of the glutes, so you're going to do 10 of those. And then we're going to move down. We're going to do a glute bridge. So you're going to go up into the bridge. Your hands are going to be located under your hips. And the reason why we're doing this is so that your hips don't drop, or you feel when your hips drop. So the idea is you want to keep your hips nice and level. You're going to push the band out. And what I don't want to see is like dropping down like this. So hips have to stay high. You're going to push out. And again, 3 sets of 10. And then we're going to go to the wall and we're going to do the glute med exercises. So we're going to come over here and we want to be close to the wall. So the idea is we want to get our body as close to the wall as we can, and we don't want our hips to move. So we want to engage our core, keeps our hips level. And then the idea is on the leg closest to the wall, I'm just going to show you on the opposite leg, you're going to lift your leg up and push sideways into the wall. And you should feel your glute med muscle, this muscle in the side here, pop up. So, but you're doing it on the wall. So you're going to just lift slightly up. You're going to push your ankle and your foot into the wall, keeping your foot down towards the wall. And you should feel your glute pop up. So we're going to hold for 10 seconds. And we're going to do that 10 times. 2 sets on each side. And this is a good exercise because it takes what's called the TFL. So the TFL is in the front here. It takes it out of the equation. So clamshells aren't necessarily a good exercise for the glute med to start out with because you can't activate the glute med. So if your hips are tight and the glute isn't firing, then you're going to end up with the TFL activating and not getting this muscle engaged.